According to the National Demographic Health Survey, the age of sexual debut is 15. What this means is that at the age of 15, adolescent girls are already sexually active, and this puts them at the risk of different sexual reproductive health challenges, from unplanned pregnancy to the risk of contracting sexually transmitted infections, including HIV/AIDS, and even gender-based violence. And this is why sexual reproductive health and rights is extremely important, because it's about empowering adolescent girls and young women to take charge of their bodies and make informed decisions so that they're not able to fall, victims of some of these vices that comes with lack of information when it comes to sexual reproductive health and rights. According to NACA, we have about 1.9 million persons who are living with HIV in Nigeria, and about 13.9 million persons who are, with disability in Nigeria. This talks about the huge number that this population are within the country that we are in. However, their sexual reproductive health and rights most times is left behind. They do face double discrimination because of their status as well as their disability. And that's why the We Lead project is an innovative approach to be able to see how we can bridge that gap in providing life-saving sexual reproductive health information to this population so that they can make informed decisions about their sexual reproductive health and rights, take charge of their bodies, and demand for those rights.
What an exciting 5 years it has been implementing the We Lead project in Lagos, Nigeria. The We Lead project is a global initiative dedicated to adolescent girls and young women whose SRHR rights has been neglected, and they include persons with disability, persons living with HIV, LGBTIQ+ persons, and persons affected by displacement. Now, during the course of the year, we've implemented so many capacity building trainings and advocacy trainings for persons living with HIV and persons with disability in Lagos State and in Oyo State. These trainings led to an advocacy visit led by these right holders whom we have trained to advocate for their SRHR rights to different government MDAs such as LSACA, Lagos State AIDS Control Agency, and Ministry of Health. We also had a capacity building training for young adolescents who are social media influencers to be able to use their social media to advocate for SRHR topics ranging from menstrual health to consent, to relationship, so on and so forth. As a result of this, we're able to reach over 1,000 young people on social media. Also, through the We Lead project, we're able to train young adolescent girls and women working in the media in Lagos State and in Osun States. As a result of this also, we've been able to have relationships, we've been able to build relationships with these young women working in the media. Also, it's been wonderful to see that as a result of the We Lead project, we have 2 policy briefs that have been developed, one for persons with disability and another for persons living with HIV. This is a key advocacy tool that we use whenever we carry out advocacy visits to government MDAs. Don't take it from me. You are going to hear from our several right holders who have benefited from the activities that we have implemented under the We Lead project. Stay tuned.
I heard about We Lead from a friend online, and then I applied for it, so I was picked, and then it was a 2 days program, which is sexual reproductive health. I learned on how to use condom. I learned different type of contraceptive and then family planning. And then I also learned on how to face audience. So this make me to pass the knowledge to my peers in LUT. Like I passed knowledge to about 30 peers in LUT. And then I also went for a program, a mental health program, whereby they asked people to come and demonstrate on how to use condom. I was the only one to come outside to demonstrate for them on how to use condom due to what I've learned in SID Initiative program. One of the interesting things about We Lead program was that I was able to go to Ministry of Health, to visit Ministry of Health and LSACA to present a policy brief on SRH and then the challenges young people are facing in receiving these SRH services. And then in this policy brief, one of those things that we put in was that they should organize maybe a toll-free call whereby they can be able to call someone on SRH services, and that there's going to be a confidential stuff.
Thanks to the We Lead project, it's a great privilege for me to know them and also to participate in so many of their programs and in different locations. I can remember one of their programs I attended. We talked about so many things on mental health, sexual reproductive health and rights, consent, relationship, family planning, and so many more. So the We Lead team actually trained the young people to become a a bold advocate, to become a public speaker. And I've been able to build that self-confidence, to build that confidence that, okay, I can go out there to train young people like me on what I've been taught in the We Lead project. So far so good. With my experience with the Lead project, I've been able to mobilize about 80 adolescents here in Lagos on mental health and SRHR and so many other related topics to mental health. So I've been able to mobilize them and educate them on what mental health is all about, what sexual reproductive health is all about. And another seminar I held in my school of study, which is the Osun States College of Health Science and Technology, is in Benin. I was able to mobilize about 67 students. I was able to mobilize about 67 students and few lecturers that were able to attend seminar on SRHR and mental health. Also educating them on HIV awareness, because with my observation in Osun State, I observed that young adolescents over there are ignorant on what their status is all about. So I was able to bring that light to Osun State in Osun State College of Health Science and Technology. So I brought more light on what HIV is, how it's spread, the control measure and the preventive measure on what HIV. I was able to share my self-testing kits for the adolescents so that they can be able to check themselves if they're having this fear of going to the clinic to do checkups. So I was able to share self-testing kits for those who are willing to check their status. So far so good. I got positive results and they were really happy that I was able to organize them to educate them. Thank you so much, Relate Project. I really appreciate.
I wasn't sure what to expect when I applied for the social media influencers training in 2022. But, it was amazing because at the training, I met young women like myself who were interested in using social media to advocate for SRHR information. We're shared in groups, we carried out activities. From there, I learned to design flyers, put together social media activities, and oh my God, it was amazing, right? And I also made friends who, eventually became partners in advocacy, right? And then fast forward to 2024, I applied to be the social media intern at SID Initiative. Amazing experience working on different projects with the team and even the We Lead project itself. And I also attended Family Planning Conference in 2024. It was amazing to also see the discourse around family planning on a global level, because I was so used to seeing it just around me, people around me, and in Lagos as well. And then I also attended the Restless Development Training under the We Lead project. Learned about my leadership skills, leadership styles, how to improve as a leader, and it has been amazing overall.
I participated in the social media influencers training under the Relate project, and it has impacted me personally in the sense that I've been able to, use my social media actively to reach out to young people about consent, about contraceptive, about more knowledge about the SRHR. Also, I've been able to, develop skills that has helped me to reply trolls online about contraceptive, especially religious people. People who believe that, you shouldn't use contraceptive, or are against contraceptive, you should abstain, knowing fully well that a lot of young people today are like sexually active. And also, I've been able to, basically put out the information there on how to reach young persons. I've been able to reach out to my friends and my colleague in school mostly, because we know we're all young people in school and we have conversation that has to, revolve around sexual topics. I've been able to, pass out information to them on how to use contraceptive, how to stay safe, and how to say no when they don't want to do anything, whether under pressure or not, and how to stand up for their right. Also, I didn't know how to calculate my menstrual cycle thing, but I've been able to, help other young persons to do that.
I was part of the social media influencers training in 2022, and from that training, I learned about family planning, SRHR, and also how young people can be able to advocate for what we believe is right in SRHR online. I planned a project alongside other young women that I joined at the training, and we were able to reach over 300 young people on social media by carrying out a series of Twitter spaces. After then, I was able to join SID Initiative as a program intern, and from there, I was able to work firsthand with planning projects under the Relief project. And then from this Relief project, I've been able to reach other young women like me especially people with disabilities or persons living with HIV, and we'll be able to train them on their SRHR and how they can advocate for their rights as persons with disabilities or persons with HIV. Aside from the projects that I've been able to lead, I've also been able to attend international conferences, regional meetings, and where I was able to share my thoughts as a young person on SRHR, and also be able to talk to decision makers and influence like policies that are important to me as a young person. And in all of this, the Willy project has been a life-changing experience for me.
So a friend of mine sent me the link to apply for the Willy program, and I was selected. And the program was for 2 days, and the program covered everything from sexual reproductive health and rights to the laws that pertains to those rights as regards to young women, adolescents, young women, also across other groups and all of that. So we learned basically everything, and also we looked at several SRHR issues that young women face, from GBV, that is gender-based violence, to rape, to FGM, and also many other issues as that. And also the main reason, and we also looked at why adolescent girls and young women are also like at the bottom of the pyramid when it comes to issues like that, and why there is a need for girls to be educated as regards their sexual reproductive health and also their rights. During the meeting, we also shared into groups to talk about issues that actually affect us. So we were made to pick an issue, and that went on for 3 days. So we used social media the best way we can to advocate for those issues. And the one I picked, I think the group I was in, we talked about FGM, and that was actually my first time even hearing about FGM, so it got me very interested, and I learned a lot even from that advocacy. We got to meet people that told us a lot more about the issue, and I also got to learn. And even after then, I also make sure that I let other people know what I've learned as regards, so that it doesn't just stay with me, so that I tend to pass it on. I can say that the program actually helped with my public speaking, my advocacy, my boldness, and also like that was also the first time I was putting anything advocacy out there on social media. So in terms of social media advocacy, I would say that the Willy project was what helped, or was what kickstarted my social media advocacy, right? So I think that is that, and I just make sure that I try to step it down wherever it is I am, or whenever I can, to other adolescents and young girls. Recently, I got to attend the consultative meeting where I was in the midst of other young persons, and we got to take a look at the policy document, the Lagos State policy document. And that was my first time looking at the document the way we did. We got to see the laws that were still dormant. We got to see the laws that are still in motion. And then we also got to learn that even after that meeting, there will be a youth advisory group that will be created for us. So even after the Willy project is gone and ended, they are still going to be engaging us on the group, which is actually a very good thing, and actually a very good initiative.
The Willy training that I enjoy the most and has impacted me so much is the SOGEC training. SOGEC is short for sexual orientation, gender identity and expression, and sex characteristics. Now, this training has impacted me so much because I've been able to learn more about my sexual orientation and also my gender identity. And now I did not just hoard this knowledge, I've been able to transfer it in trainings that I've been going to, and also in my communities as well. When someone is saying certain terms when they're not supposed to, or using certain terms wrongly, I'm able to call them out and say, oh, this is how you should say it. This is how you can do it better. And this is what this actually means. So I've been able to educate more people, especially young people, on their sexual orientation and gender identity.
I was involved in the Willy Project self-care workshop that held in December, and it was a transformative experience for me. You know, before now, I'd always thought that self-care was selfish, but then the workshop opened my eyes to see that this is actually not selfish. It is something you need to do for yourself occasionally. Hang out with people, prioritize your sleep, prioritize your mental health to actually do you a whole lot of good. And since then, I have made sure that I go for massages if I need to, hang out with friends if I need people to talk to. I don't just bottle everything in, because self-care actually does you a whole lot of good. And since then, I've also been able to share this information with people around me,
that prioritizing your self-care and your well-being is actually very important, and it will help you in your daily activities. You'll be able to give the best of yourself. You can't pour from an empty cup, so you need to take care of yourself in order to do that. The We Lead Self-Care workshop wasn't just a transformative experience, it had a ripple effect on me, and I would take that going forward in everything that I do.
I attended the end of the year self-care workshop under the We Lead project as a volunteer, and it was just the most amazing thing ever. We gathered and we talked about our year as a volunteer, the impact we have made, and how we can do better moving forward in the new year, in the new coming year. And I learned some practical self-care skills, like, just taking some time to just slow down, to just reflect on the year that is. And this helps me even in my workplace, even outside of volunteering. It helps me in my workplace, in my personal life. It helped me to just calm down sometimes when life can be overwhelming. And then this has helped me in general to boost my focus and improve my productivity. And I took these self-care skills out to my friends. I introduced it to my friends as well and told them that we need to hang out more. We need to stop postponing hanging out or just catching up, because sometimes we get to do that and we just forget about sitting down and reflecting. And this has just really helped us. It has helped our communication with each other, and it has brought us closer. My experience with SID has been amazing because I have learned a lot of things about sexual and reproductive health and rights. It has helped me understand that being impactful sometimes doesn't have to be a big thing. You don't have to do big gestures. It could just be speaking up for someone that you feel might be getting bullied somewhere, or just when you see somebody like spreading misinformation, it could just be like correcting that notion the person is trying to spread. And it has just helped me in general to boost my own confidence and my own person, knowing my rights as a woman and as a human being in general. And this has helped me to move better and to make better decisions.
I attended the safety and security training for the We Lead project, and I have two key takeaways. First of all, situational awareness and use of social media, which can be used for a good thing. But at the same time, we also have to be very conscious of not putting all or too much information out there that can be put together and used in a bad way, like date of birth, phone number, account number, place of work. Those things can be engineered together, and you could lead something else. And for me, as a woman who likes to work like every day, I like to use my headsets a lot, and listening to music and being on the road at the same time can be dangerous. It's dangerous. But the We Lead project also reinforced what I know again, that I can't afford to always do that every time, because I have to be very conscious of my environment, for myself and also for the safety of others. I remember that at the same time last year, my cousin was reported to me that she does the same thing. And got so good that I had the writings of the training down. And I was like, you know what? This is not even about you. But because these things are way too rampant, and we also have to learn to keep our safety to 100. I was like, you know what? We had a conversation, and I said, if this project should come up again next time, I don't mind you being there. Because I know you want to go for a walk, you want to be on your phone every time, you want to listen to music, put your headset on. It's fine, I agree, I want to do the same thing as well. But guess what? Your safety is 100. Not for yourself, like I said earlier. For also people that are on the road, for road users, for you, for your family. People should be able to know that okay, they can contact you, they can say you are safe. Because when something's happening on the road, someone says, hey, but you're with headsets. How do you pick that? So again, safety and security, for women especially, we cannot afford to bring it to a year. It has to be at 100 every time. It's unfortunate, but we also have to be guarded.
As an organization, one of our values in SID Initiative is partnership and collaboration. This is extremely important to us because we believe that alone there's so much we can do. But with partnership and collaboration, we can expand the reach of our work as well as the impact of our work, which is extremely important for the kind of work that we do. And the We Lead project was no exemption. We partnered with so many amazing initiatives and organizations, from ISHRI to Half a Health Initiative to Value Female Network to Speaking Fingers to the Action for Positive Active Youth in Nigeria, APIN, working with all of these organizations, we're able to mobilize our target audience, we're able to build their capacity, we were able to integrate areas in which we hadn't worked before. We've been able to talk about, intersectionality, what that looks like. And we didn't just stop with our right holders, we also brought it into the organization by building the capacity of our staffs and our volunteers to be able to provide inclusive SRHR information and services. And we continue to, keep this going, even in other projects and programs that we are going to be having as an organization, even when the Relief project comes to an end.
Working with SID in Oyo was an exciting opportunity to learn about some of the challenges that adolescent girls and young women face when it comes to their sexual and reproductive health and rights. It was the first time working on something like this with them in Oyo State. I was part of the process, not only as a facilitator, but also the mobilization process and also on writing the policy review that was drafted after the project. We saw how some of the participants were able to step down the training unsupervised, and it shows how much the We Lead project helped bridge the gap in knowledge that most of these adolescent girls and young women face. And I hope that this partnership will be sustained and continued so that this marginalized population in Oyo State are able to benefit from programs like this.
My organization partnered with SID in the We Lead project. We were able to help SID to mobilize young adolescents and young women with disability for the We Lead project. I was opportune to, be a facilitator for this project. It's really a great pleasure for me. It was a 2-day project. We had about 30 young adolescents and young women with disability in that room. And as a result of that 2-day training, young adolescents and young women with disability were aware. They became aware of their sexual and reproductive health rights. And we also used the Lagos State Special People's Law as a tool to work with. And we believe that in no time, these laws will be fully implemented for young women with disability to start enjoying their health and sexual reproductive rights. We believe that very soon the health facilities will become accessible. And we hope in the near future that other organizations will collaborate with SID so that we can get a full implementation of this law and help PWDs to enjoy their sexual and reproductive rights.
So Israel collaborated with SID Initiative to implement some of the trainings they did on the We Lead project. And I personally facilitated the SOGEX training for female media practitioners. The training was so diverse and so rich that they had participants from mainstream media, the newspaper, radio, and also social media. It was an eye-opening experience for me because I got to, listen to real-time realities and experiences of these media practitioners, and we got to hear answers to reasons as to why some issues, for instance, of persons living with HIV, women and gender diverse person is not thoroughly discussed on mainstream media. And the experience has been so impactful because I engage with some of the participants and I see the work they do. It has really, it's like a paradigm shift. It has really changed the narrative around the conversations we had for this person. And it is very impressive to see organizations like SID do what they do. That's why Israel as an organization is really looking forward to more collaborations in the future, because as an organization, we believe partnership and collaboration is one aspect of our work that we cannot overemphasize, right? So beyond the We Lead project, we look forward to, more years of collaboration, and we look forward to, decades and decades to come of growth and passion, collective passion in implementing programs for, gender diverse persons in Nigeria. Thank you.
Partnering with SID Initiative on the We Lead project was an amazing one, and I was opportune to mobilize the participants, the women in media, for the advocacy, SRHR advocacy and reporting. And I'm glad to see the impact that the We Lead project has had in Osun States, because one of the participants shared with us that they now have a session that talks about issues that affect girls, the radio station that she works with. And that was an amazing one. I also observed that one of the participants now uses their social media platforms to talk about SRHR issues. So that's a big one, that's a beautiful one. So we look forward to more programs, more initiatives like this in Osun States.
Over the past 5 years, we've focused on building a system that ensures financial accountability and transparency. The Relate project was a major milestone for us as an organization because it helped open doors to more fundings for us and also helped us implement more projects. We are also exploring a social enterprise model that will help us generate funds while delivering impact. Our next steps involve diversifying funding sources and strengthening internal capacity to sustain our work long term. I'm really excited about all of the amazing impact that this project has had on adolescent girls and young women, especially, persons living with HIV and persons with disability. This was a learning experience for us as an organization because we had never done previous work like this before. I am extremely excited for all that these girls are going to, go do within the community, how they are going to be able to step down the things that they've learned to their peers. But more importantly, I'm absolutely proud that they now take charge of their own bodies and are able to make informed decisions when it comes to their sexual reproductive health and rights. I'm calling on the government, on civil society organizations, on donors to support the ongoing work that we are doing, to collaborate and partner not just with CSOs but with youth-led organizations to see how we can scale up the work that we're doing. As an organization, to sustain the gains of the Relate project, we've developed several resource materials from toolkits to policy review documents, even this documentary that we're doing. And what we are saying is that, support the work we're doing by sharing, engaging with these resource materials, making use of it within the work that you're doing. Find ways to integrate, these marginalized groups into your existing SRHR programming. And finally, to any young girl who is out there right now listening to me and watching me, know that you are a star. Know that, your sexual reproductive health and rights is in your hands. You have a voice and you can demand for those rights, to be upheld. Because in Relate projects, we rise, we transform, and we uplift others.
We